Welcome to This is Getting Old. I'm your host, Melissa B., PhD, and today I'm joined by Lieke Van Heumen. And today we're going to be talking about aging and intellectual disabilities. So welcome, Lieke. How are you?
Good. How are you, Melissa?
Doing good. So maybe you could just introduce yourself and kind of tell people what you've been up to in your career within the aging space.
Absolutely. Thank you. And thanks so much for having me on today. So I'm a clinical assistant professor in the Department of Disability and Human Development at University of Illinois at Chicago. And my research focuses on aging of people with intellectual and developmental disabilities. I hold a PhD in disability studies, also from UIC, and I'm currently a health and aging policy fellow. I'm originally from the Netherlands, and I finished a bachelor's and master's in gerontology before I moved here. And I worked both as a direct support professional and a psychologist in the south of the Netherlands with adults with intellectual disabilities.
Okay. So for anybody that's listening today, if they don't know because an intellectual and developmental disability, those are several big words put together. So what does that concept mean?
So developmental disabilities is an umbrella term that includes a lot of different disabilities that start in the developmental stage of our life. And intellectual disabilities is just one disability that falls under that umbrella. So people that have intellectual disabilities have both a significant limitation in intellectual functioning as well as adaptive functioning and adaptive behavior. So those are the kinds of skills that we need in our everyday lives to live independently, thinking about challenges with language or money, understanding time, social skills or more practical skills that we all need in our everyday lives. So intellectual disabilities start before the age of 18. So that's what makes it different from, let's say, a traumatic brain injury that occurs later in life. I might have similar functional challenges for adults.
Okay, but it's also different than Alzheimer's, even though that is a cognitive issue.
Yes, exactly, because Alzheimer's or other dementias start later in the life course. People that have intellectual disabilities are also prone to develop Alzheimer's disease and other dementias, but they will have lived their whole lives as a person with an intellectual disability. And what you hear a lot about is people that have Down syndrome have a much higher probability of developing Alzheimer's disease compared to other older adults.
Okay. So what makes this population unique as they age?
So what's really interesting is that it's the very first time in our history that large numbers of people with intellectual and developmental disabilities live into old age. We all live longer lives and we all have longer life expectancies, and that's the same thing for this population. But because we haven't really seen that before, we're not adequately prepared, and that's one of the main challenges that we see right now. Just as an example, like a child with Down syndrome in 1929 would live to 9 years of age on average, and today someone with Down syndrome might very well live into their 60s or 70s. So that's a really drastic increase that we've seen.
Yeah, so why is that? I mean, that's interesting.
So it's the same reasons really that all people live longer. We have better healthcare, better social opportunities, and those have just significantly impacted the lifespan of people with intellectual disabilities. Though folks that have more significant disabilities or multiple disabilities, they do not have the same life expectancy, but it's still much longer than it was ever before. I think that one of the challenges is that we see a big increase in the number of people with intellectual disabilities that are reaching age 60 or beyond. And right now we have a little over 600,000 people with developmental disabilities in the US over age 60. And by 2030, that number is projected to double or even triple. So that's a really big change that we need to prepare for. But still, their absolute numbers are kind of small compared to the general older population. So there are so many demands placed on our systems that, it's easier for this group to be forgotten, even though they have very unique needs and live lives with a lot of challenges.
Okay, so in thinking about some of the policies and things that we need to have in place for this population, what are some recommendations that you have that we need to be doing?
So the major policy issues that are raised by the existence of this population are similar to those that really all older adults with disabilities experience, regardless of whether they have aged with a lifelong disability, so aged with disability, or aged into disability. So having affordable residential options, having good access to healthcare and long-term services and supports, having supports available for family caregivers, having adequate transportation, economic security, consumer direction in services and supports. Those are just a few of the challenges for those individuals and their families.
And those exist even earlier in life also. So does it change? How does it change as they get older?
Yeah, so I do think they become more pronounced. We know that adults that are aging with intellectual and developmental disabilities, generally speaking, most live with family caregivers. So you get into a situation where family caregivers themselves are aging and might pass away or otherwise become unable to provide that support. And unless we really help support families to plan for the future and what old age will look like for the person with an intellectual disability, we have a challenge on our hands. And we do know that most adults with intellectual disabilities, they're much less likely to be married or to have children. So once their parents pass away, unless they have siblings or other family members or friends that can provide them with informal supports, they're much more likely to end up socially isolated or without people that care for them and that really can advocate for their needs. So when we see individuals that are older living in group homes or other residential settings, they are supported by formal staff, and that is just not the same as having the love and support of family members and really someone that can advocate for their needs. And we see in this population, if we really look at this from a life course perspective, with the adults that are now in their 60s, 70s, 80s, they grew up in a time before the IDEA, before the ADA, and they lived in a time where they had such limited opportunity. They were much more likely to be institutionalized, to lack access to the community, to employment, to education. Like that, those disadvantages really accumulate to further disadvantage later in their lives and poses risk to their health and well-being in a way that's going to be different from, let's say, the older adults that we will have in 30 or 40 years. It's going to look different. So I think that's, really using that life course perspective is one thing that's really important to keep in mind as we think, how can we appropriately support this population? How can we really engage with those experiences in a way that are meaningful? And how do we put an aging capable spin to the services and supports that we have?
So what organizations kind of help families that are dealing with this as everyone kind of ages together, the parents and the person with the intellectual disability?
So I think there's a distinction between families that have been in contact or are connected with disability service providers and those that are not, until the moment where their first point of contact with more formal services might be through the aging system. So it kind of depends on which road a family has walked in their lives. So obviously, people can connect through the Aging and Disability Resource Centers, through the area agencies on aging, and then in their state connect with their Developmental Disability Council. Here in Illinois, you go to a service coordination agency that starts a process of providing home and community-based services, if that's what people are looking for to receive. One really good place for information and supports is the ARC of the US, which is the largest advocacy organization for families and people with intellectual and developmental disabilities. The ARC has a lot of different state chapters, so you can also connect with your local chapter.
So what does ARC stand for?
So ARC is, at this point, doesn't stand for anything anymore. It used to stand for something, and the R was the R word, but we have moved on from that. So at this point, it's just the ARC.
Oh, I was thinking Aging Resource Center.
No, it was an organization that got started after the Second World War by families of young children with developmental disabilities that were advocating for access to education for their children, which at that time was lacking very much. So, but we have come a long way since then. So
we've come a long way for children and families living with.
Yeah, we've come a long way with disability advocacy since the 1960s and 1970s. Obviously, there is a lot of work left to be done in creating better opportunities and equal opportunities and justice for people with disabilities. Really supporting individuals to live in a community with supports and changing some of the negative attitudes and stereotypes that we continue to see in our communities. But nevertheless, we've come a long way since the ARC first started.
Okay. So then you have those kind of stigmas and stereotypes, and then you add aging on top of that, because we've seen a lot of ageism, in light of kind of COVID-19. So how does that overlay of ageism on top of what they've already experienced, how does that play into it?
So I think that's a really good question. It's aging and ableism, right? So it's a combination of those two systems of oppression. So I mean, it's challenging. There's so many different ways that you can think about the lives and the experiences of adults with intellectual and developmental disabilities. And sort of the main takeaway is that we have to become more inclusive in everything that we do. Nothing about us without us. So engage with these adults themselves. What are they experiencing? What does aging mean to them? What are their desires for their future? And that's one of the things that is really challenging. I remember working with a family, a sister of a brother with an intellectual disability, and we were doing a training on person-centered planning. And the brother had a significant intellectual disability, but we were coming up with ways to engage with him and really gauge, what is important for you in your everyday life, and how can we organize the supports so that you can live your life the way you want to, as an older adult. And I remember the sister telling me that it was the first time in his life that anybody ever asked him what he wanted to do.
Ask him what matters.
And what matters to him.
Health system. Number one, what matters to you?
Yeah. Really that promoting the self-determination and not speaking for people, but coming up with other ways to listen. Because people often have some challenges in traditional communication, but that doesn't take away that we need to find ways to communicate and to prioritize what people are able to share, and to become creative in ways to capture that voice. So one of the sort of strategies that I often talk about when we really think about using person-centered future planning is to come up with a way to integrate life story work. And we see life history work a lot in gerontology, and we're starting to see it being used in sort of the disability arena as well. And especially for adults that, because of their disability, might not be able to share their own life history, doesn't mean that knowing about their life history is any less important. So we depend on others to make sure that we can record that and really understand and savor that life history. And especially, you know, once family members pass away and people are dependent on sort of formal services and supports, and if someone lives in a group home, there's so much turnover in staff that just in a year time, there might be hundreds of caregivers that interact with that person. And then you might really ask yourself at some point, who still really remembers or knows who this person is? So having that life story work be part of the person-centered planning that we're doing has a real potential and value to really support that person more effectively and appropriately.
So you mentioned kind of caregivers and our direct care workforce, and the turnover you mentioned sounds pretty similar to what we see in nursing home settings. So what are some of the challenges that the workforce for this population faces?
It's very similar, you know, very low pay and low appreciation for the work that these individuals do and how important that care work is. And that the fact that we need that and that people need to be paid well for that, and that it's a career choice to have that as a career, and coming up with ways to minimize the turnover, because there is just a lack of direct support workers all across the country, and it's created a really big crisis. And unless we resolve that, we cannot improve the quality of the care that and supports that are being provided and that people deserve.
So when you say direct care, are these like nursing assistants? Like, what are some of the job categories that are in the area?
QIDP, so a qualified intellectual disability professional, is the official term for that. So these are individuals that provide direct care, so physical as well as other behavioral supports within a living setting. So, and I'm focusing sort of on home and community-based services, right? So group homes, community integrated living arrangements, but also in-home support, so where a direct support professional comes into someone's home and provides that support there.
So in terms of this workforce, obviously you're having a lot of turnover, that's one thing, but are there also, there's a need for more people to be in that workforce?
Oh, absolutely. There's a big need, and there's a good campaign going on and has been for the last few years called They Deserve More. So disability organizations have really connected on this and try to become an advocacy voice to convince policymakers what a big problem we have on the front lines. And currently, with the challenges that we see in our communities with COVID-19, it's only worse. So there is staff that actually now is living in group homes. They don't go home anymore. Other staff that has children at home, they might not be able to go to work and keep that job, or might not think it's worth the risk. And especially because it's low paid, you know, there's not enough personal protective equipment. And unfortunately, the definition of frontline healthcare workers is not inclusive to individuals that work in this area.
So that's interesting. I did a radio show yesterday talking about nursing homes and kind of why are we just hearing about nursing homes? And it's almost like I can see the hospital's got all the attention. You know, now nursing homes are getting the attention because we have a higher number of people who actually are dying, you know, in massive amounts compared to people that live in the community. So group homes kind of face the same challenges that nursing homes face because they're all the residents are in close proximity, so you can't do the social distancing.
Exactly. And as usual, they're a group that are an afterthought. And it causes a lot of frustration in the disability community, rightfully so.
Right. I mean, because it's frustrating for us, you know, that the nursing homes are neglected, and it sounds like you're even kind of farther down the totem pole of who's getting the attention and the protective equipment. So
disability advocacy organizations are definitely asking for supports and creating a conversation about this. And it really kind of goes back into this idea of, whose lives are valued. And we can see these articles pop up on healthcare rationing and, if there's not enough ventilators, who gets one, who doesn't. And that causes a lot of anxiety among people that are considered vulnerable by the current challenges with COVID-19. So it's next extra challenging time.
Yeah, I mean, I can see that because I've been reading a lot of stuff about just how people are being discriminated against just based on age. Like if you have, a certain number of ventilators, like I think in Italy they cut off at 60. They're like, if you're over 60, you need a ventilator. Well, you're just not going to be given one, instead of this kind of personalized, a little bit more tailored approach based on your overall kind of health picture. So as people with intellectual disabilities age, they also have more chronic illness? Because you mentioned we're all living longer, and that's because we've gotten really good at handling infectious disease. So now we die from chronic disease.
Yeah.
Although COVID is putting a little cramp in that.
Yeah, so on average, people with intellectual disabilities have twice as many health problems compared to other people. And especially older adults with intellectual disabilities have significant health concerns. And that's just something that we need better awareness of and better training too. So the medical professionals to really understand sort of what unique needs do we see in people that have an intellectual disability or a specific syndrome that they're aging with. What does that look like? What are the vulnerabilities? But also sort of direct support providers as well. What do we need to be alert of? How do we interpret certain things that we might see? So this kind of comes back to capacity building to understand what sort of the unique things that we see in that population.
Okay. So some of the things that we were talking about that we needed to kind of get ready for, obviously this population has challenges around building the direct care workforce, making sure that our home and community-based services are in place. So not necessarily just focusing on, group homes, but what are some of the other services that need to be in place to support people that may still live at home with their aging parents, or even a sibling or somebody else in their family. What other things do we need to be thinking about?
So honestly, better coordination of the aging and disability service systems, because this is a group that really needs both. And sometimes they aren't eligible for certain aging services because of their chronological age. They might have aging issues way before they're 60 or 65. So that can cause an issue. One of the most recent areas that is being looked at by people that work on this issue is that of retirement and what the transition to retirement looks like. We know that a very low percentage of people with intellectual disabilities, especially the older generation, has had any kind of competitive employment history. So they often are in day program services or other day activities that are not necessarily competitive employment. And they're participating in these services, but they're not, at some point, might not be what matches their lifestyle and desires anymore. When someone is 70 or 75, do they really want to be bused to a day program every day from 9 to 5? However, the group home they live at might not be equipped to have staff at home during the day and to come up with meaningful and individual ways to engage older adults in the way that they want at that age. And in a day program, you can see some of these have like special senior groups or coming up with ways to be more attentive to that. But it's often still an environment that's not the most conducive to what older adults need. So even understanding like what is retirement, for what are people retiring from, what are they retiring to, like that is one of the main issues at the moment that we see people that start to engage with that question.
Right. Well, and if this is the first time that this population's really even lived long enough to reach what is considered the normal retirement age,
Exactly.
it's made me think they need a completely different pathway for managing, late life.
Yep.
And, you really don't ever hear about how that's different, because I was just thinking, well, do they try to start, a retirement plan? But if you try to save your money in that way, you have to be 65 before you can, or 63 and a half before you can access it. So that maybe that's not the best way to do their financial planning.
And honestly, keep in mind that many adults with disabilities, live in poverty.
Right.
So they don't really have they're on a day-to-day basis, sort of the financial supports that they receive, they don't really change necessarily. So we need to come up with new ways that engage people in their communities and in with their families.
Yeah, so I was just thinking through that they have a lot of challenges. So we have this current system, and if you could start over, are there any trends that you see emerging, or any ideas you have to kind of fix? This is basically a super hot mess.
That's a good way to put it. That's really hard.
Nursing home was bad, but now I'm like, okay.
I don't mean to make this a depressing conversation. I just think it's important that we are aware of this population and that they have some unique challenges, and that we need to make sure that we better prepare to respond to them as we figure out how to really design and move our aging systems and services forward. Like, this is a group that's part of that aging society that we're seeing. But in the same time, overhauling a whole system, that's, we kind of think about like how would you start from scratch, but really figuring out how to make adaptations so that the long-term services and supports that we have in place become better equipped, and that this group finds a place in that in an integrated way, without just thinking, oh, but they need something separate. So, let's just start separate homes just for them, versus, what are ways that we can include these individuals in our senior centers? Like, what do people need for that to happen?
Or even just intergenerational housing. Because, that kind of helps everyone in the community, and it should be an inclusive environment.
And you see that there's lots of cool initiatives pop up, in the last decade or two, with ways that people are trying to have those sorts of creative solutions in place. Yeah, like coming up with ways that in supportive living that's sort of designed for the general older population. We see more examples of people that have intellectual disabilities finding a way to live in those settings and be part of those communities in a more successful way than we have before. And more people becoming aware that we have to sort of bridge these aging and disability systems so that people don't sort of fall in between, because they need to find a way to connect to both. But then, if the disability services aren't really adequately prepared to figure out how to support their aging customers or clientele, for lack of a better word, and aging services that really haven't seen older adults with lifelong disabilities or really understand the intricacies. Like, we got to build capacity on both sides and come up with ways to better integrate the expertise that exist, but some of the different paradigms too, and try to sort of promote collaboration in that regard. And just the administration of community living that has brought those systems together. I mean, that's just propelling us into moving forward that way.
So we mentioned the Administration for Community Living. So is that kind of the federal agency that tries to bridge the aging and disability population with the aging population?
So, came out of the Administration on Aging and Administration on Developmental Disabilities, and really brought them together under one umbrella in the way that federal programs are being administered. That really encourages crossing the aisle and coming up with ways that we are supporting people with disabilities and older individuals across our communities more broadly.
So, this podcast will raise people's awareness just by kind of having a conversation about it. But if someone was interested in learning more about, to build capacity, do you know of any resources that we could connect them to?
So again, I would firstly recommend the ARC of the US, which has a lot of really good information for families. They actually also have a future planning tool on their website that families can use to really start thinking about what is aging going to look like for me and my family and my family member with an intellectual disability. The ARC has the local chapter. So for example, the ARC of Illinois has a family support network, which is a really great way to get connected. And as far as services go, you can go to eldercarelocator.acl.gov to find your Aging and Disability Resource Center. You can also find your area agency on aging, as well as the local Center for Independent Living. So those are sort of the first resources that I would point people to, as well as the state developmental disability councils.
Okay. And so if people wanted to get in touch with you to learn more about your work, what's the best way to get in touch with you?
Absolutely. I'd love to get an email from you at lvheumen@uic.edu. And I'd love to speak some more with you and provide you with more information.
And then you're also on LinkedIn?
I'm also on LinkedIn.
Okay, just with your name?
Just with my name, correct.
Okay.
I'm not a social media superstar, but there's not too many Lieke Van Heumens. So if you just Google my name, you'll find me.
Okay, very good. Well, thank you so much for being with us today and for sharing your expertise and highlighting this important population and sharing resources and different things that we need to be thinking about.
Thank you for having me, Melissa.
Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.